much for coming along to learn some baby massage today with Jasper. I'm very excited about teaching you.
Can't wait.
So just before we start, just so you can just be comfortable with what we're using for massage, we're going to use organic sunflower seed oil, which is here. Now the reason why we use it is because it's packed full of wonderful things that are great for the skin, and you've probably noticed Jasper putting his fingers in his mouth quite a lot. So if it does go into his mouth, it's not going to hurt or harm him. It's really easily absorbed within the body, and it's really hypoallergenic as well. But we want to be 100% sure, so we're just going to start by doing a little patch test. So if you want to put a tiny bit of that oil just on the corner of, on the inside of his wrist or inside his elbow, and then we'll just see if he's cool with that. Apart from that, he's happy and healthy. There's no other things to be worried about. He's not been poorly or tummy ache, diarrhea, fever. Great, okay. And he's got no other little allergies. It's sneezy, but okay. Alright, so we just leave that there for a moment, just while I explain what we're going to do today. So we're going to try and do a little massage with Jasper. Obviously he's in charge of the class, so we're going to do exactly what he wants to do. So we're going to start with the legs, because he probably is quite used to maybe having his legs lifted up, nappy changing and things like that. We're going to move on to the tummy if he's happy, then onto the chest, and then the arms, a little bit on the face, and then with the back as well. But we'll just see how it goes. It's better to do 5 minutes of massage with him when he's really happy and you're happy and relaxed, and kind of try and do the whole thing. So he's very much in charge, and we'll take the lead from you. All right. So do you want to just check and have a little look at that?
That's all right.
Okay, fabulous. All right, that's brilliant. So what we're going to do, just to loosen up before we start, is just give our hands a little shake. Have you got any jewellery that's spiky, or is it all kind of wedding ring? Or,
actually, I'll take that one.
because if there's anything that might catch, just good to check. If your hands are quite clean as well, that's good too. So just give our hands a little shake out like that. Okay, and then we'll shake them all the way up. We say hello, Jasper. Okay, and then a big stretch up to the ceiling. Just stretch out your back, always good. And then we're just going to bring our hands down to the side, and then we're going to bring our hands out to the front. Just stretch out your upper back and then push through that way. A deep breath in, and we breathe out. We're going to come up, and then we're going to say hello again, a little wave, and then we're going to come down and very gently give them a little stroke all the way down. Okay, fabulous. All right, so that's just to kind of get you in the mood to relax as well. So he's going to pick up on all of that. Okay, so what we're going to do is we always ask permission to massage before we start. So if you want to put some oil in your hands, about the size of a 10p piece we start with. Obviously his skin, your skin's going to be different, so it depends on how much oil you're going to use. And then what we always do is ask before we massage, because he has to be in the mood, he has to want to have a massage. It's really important, and we'll look for those lovely cues. He's given us some really good ones now. So what we're going to do is warm the oil in our hands, and then this sign, eventually he'll get to recognise he's going to have a yummy massage, get really excited. So we can say, are you ready for your massage?
Are you ready for your massage? Oh, I think you are, aren't you?
Okay, so you get some beautiful eye contact there, and he looks really relaxed, which is great. But if you do see throughout the massage, maybe you know him better than anyone, any little tense signs, just pick him up, give him a cuddle, and stop. All right, so we're going to start with one of those lovely legs. So it's up to you which one you want to choose to start off with. Okay, and then we begin by giving it a little bounce like that. So we say, relax, Jasper. That's it. Okay, that's it. Nice and smiley. So you just keep bouncing till it feels relaxed, and when it relaxes, you're going to give a lovely big cue, big smile, and say, well done. Well done. Okay. And then what that does is it makes an association for him. But when he relaxes, he gets a lovely smile from his mummy. Yeah, that's good. Alright, so let's have a little go then, starting with our first stroke, which is an Indian massage stroke. So we're going to secure the ankle like this with one hand, put the other hand here around the hip, and then we're going to come all the way up. That's it, lovely. And swap hands, and then again from the thigh all the way down to the ankle. So each hand changing each time, as it says, like a lovely sort of fluid movement all the way through.
Can't take your hands off.
So what we're doing here is we're helping to bring the blood all the way down to the foot, warm up those little toes. Sometimes you might have noticed
a bit chilly,
a little bit chilly, a little purpley. And we're also stretching out that lovely leg. It's probably doing quite a bit of kicking.
Yeah, massive.
And also we're bringing the tension out of the body as well, because this is an Indian massage stroke. Indian massage always works away from the body because it's kind of believed that if you're tense or stressed, you'd want to release that rather than pushing it into the body. Fabulous. Okay, wonderful. So let's try our next stroke, which is called ringing. So we're going to put our hands here and we're going to do a little kind of ringing stroke. So moving the hands up the thigh like this. So basically ringing is another Indian massage stroke. It's getting all the tension out of the legs again. And it's also good for children with growing pains as well. So I don't know if either of you know that. So you get kind of the achy knees, so this is a nice one to use with older children as well. Fab, well done. Okay. Alright, so then we're going to move on to that lovely foot. So we're going to cradle the foot in our hands and we're going to do a number of different strokes which are based on the practice of reflexology, right? Which is the idea that each part of the foot corresponds to a different part of the body. So if you stimulate a particular area, it brings a positive effect elsewhere, right? Have you ever had it when you've been pregnant? Or? Yeah, okay. So we're going to have a little go with that. So first of all, let's relax the whole foot. We're going to go from the heel to the toes, like that. And sometimes they are a little bit sensitive with their feet. You're probably getting that reflex.
Yeah, it's curling his toes.
Yeah, so that's one of the first. The reflexes are, the sign of baby having quite an immature nervous system, and they kind of die down in the first few months of life as the brain kind of takes over and the nervous system matures. Okay, that's it, lovely. So then we're going to work on those toes. So we're going to do this little piggy, you know that one. So instead of when we get to the little toe, instead of where we normally go, tickle, is nice and chilled, we're going to say, and this little piggy went to sleep. Okay. Okay, should we try that? Alright, so let's start with the big toe. So we're going to say, this little piggy went to market. This little piggy stayed at home. This little piggy had roast beef. And this little piggy had yum. And this little piggy went to sleep. That's it. Maybe they just go to sleep.
Of course.
Yeah, it's perfect. Bedtime routine. Like for the film. Such lovely. Okay, so now what we're going to do is with our first finger, put a little bit of pressure underneath the toes. Toes are going to curl around tight, and this is the area for the sinuses. So if you have like a sticky eye, blocked nose, this is the area traditionally in reflexology you stimulate. So it's the same thing with babies. So a little bit of pressure there, and then we're going to bring the same finger down to the arch of the foot. And the arch of the foot, the middle of the foot is like the middle of the body. So this is representing the diaphragm and the stomach. So sometimes kind of windy, colicky babies, they quite like to have stimulation. Okay, so then with the thumbs, we're now going to walk all the way around the foot like that. So this is really good to teach Jasper that he has a foot. Because I know it sounds weird, but he has got no idea at the moment that he has a body, that he exists. That sort of self-awareness doesn't come to him in about 18 months. So every time you touch his body, you help him to get a better sense of body awareness, proprioception of where everything is. So something as simple as that, playing with their feet, actually is really beneficial. Lovely. Okay, so turning the foot over, what we're going to do now is stroke from the toes to the ankle, like that. That's it. So this one's just really nice and relaxing. It's going to help to stimulate a little bit of lymphatic drainage and start to bring the blood back towards the heart now. Alright, so round the ankle now with the thumbs. So keeping the joint nice and healthy and strong. So how much moving around is he doing at the moment?
Oh, he wiggles a lot.
A little bit of wiggling.
Yeah, but he's not rolling yet.
Okay, so when he starts crawling, all of the weight of the body goes on the ankle and the wrist joints. So actually this is a really good time to remember this one to help to release any tension out of there. Beautiful. Okay, so back now onto the leg. We're going to secure the ankle like this, and we're going to return the blood back towards the heart. So we're going to come back from the ankle to the thigh, swap hands, and then back again. So this is basically the opposite stroke that we did at the beginning. You know, we did the Indian draining, releasing the tension from the body. This is called Swedish draining, and what that does is it works on the basis of Swedish massage, where we're bringing all the blood back towards the heart. So boosting your circulation. You're very chill, baby. Okay. So then what we're going to do is finish off this lovely leg with a little slightly more stimulating stroke. We're going to roll like this from the top all the way down to the ankle, and we're going to do a little song which is Jelly on a Plate. Do you know Jelly on a Plate? Okay, cool. Alright, so we do a little bit of singing, because Jessica loves your voice. So we're going to say, jelly on a plate, jelly on a plate, whipple wobble, jelly on a plate. And again, jelly on a plate, jelly on a plate, whipple wobble, jelly on a plate.